Hi, everybody. My name is Christina Richburg, and I'm the parent advisor from the um, Department of Health and Mental Hygiene. And I'm here to present on strengthening peer support through cross-system collaboration, building bridges for better support. Thank you all so much for coming. So, what are we going to learn about today? We're going to gain a better understanding of peer support. We're going to learn who our cross-system partners are. We're going to learn why cross-system collaboration is so important for peers, as well as to address barriers for cross-system peers to collaborate, the benefits of cross-system collaboration and keys to successful collaboration, and the real power behind cross-system collaboration. And then we're going to talk about a call to action that I would like to do with everybody moving forward. So let's do a quick icebreaker. Let's get to know each other. Whoop, whoop, whoop. I am really a very hands-on person. I am a people person, and I wish that we could be together in person, but unfortunately, due to the climate of this country, we can't right now. Hopefully, we'll be able to meet sometime in the future, but we can't right now. So I'd like you to introduce yourself, name, title, and one thing you've done as a peer that you're really proud of. If you can unmute yourself and just let me know who you are and one thing that you did that you're proud of. Okay, Lori Kavanaugh.
Hi, I'm Lori, and I'm the program manager for peer services. And one thing I've done as a peer that I'm really proud of is probably I worked with a group of moms who were in prison. They were in like a reentry center. And we together as a group put together a 6-week curriculum about parenting from prison and also parenting when getting released from prison.
That's amazing. And
And
tell
it,
me one famous landmark from your state.
oh, let me see. Famous landmark. I'm gonna say Portland Pier. Not
Okay.
too many people know about it, and I'll
Woo
put my name in the chat.
woo. Thank you so much. Who's next? Angie, you can unmute yourself.
Hi, I'm Angie Chilton. I'm a family support partner. I just got my crisis credential. I the biggest thing, I'm a parent ambassador for the state of Missouri. We're
Mm.
piloting a program where I work as a peer with parents that have had interactions with Children's Division. We're trying to get to a point where they get a peer before the crisis has come in, right? They're learning the resources so they can get the help they need so that children aren't taken into care.
That's excellent. Thank you so much for what you do. And what is a famous landmark from your state?
I mean, we have the arch, the biggest one.
Okay. Woo, woo, woo.
Thank you.
Excellent. Excellent. Uh, Jennifer.
Are you calling me, Christina?
Hi.
Hi, how are you? So, Jennifer Fuchs, I'm director of peer services at SCO Family of Services in New York City. And something that I am proud that I have done was build a peer workforce in my organization. And also a famous land. I mean, I mean, like we have a bunch in New York City. Um, let's see. I mean, we've got
Name your favorite one.
my favorite one would be the Empire State Building, and just because I have many memories as a child there. So
Excellent, excellent. Thank you so much.
you're welcome.
Okay, I'm gonna move on to Felicia, and last will be Tracy. Felicia.
Hello, good
Hi.
afternoon, wherever everybody is from. My name is Felicia Mason Edwards. I'm the mental health director of peer support and recovery at Texas Health and Human Services in Texas. And probably the coolest thing that I just got to do is I recently went to Africa. I just got back last month, and that was the
Wow.
first time I had been on the continent of Africa, and I was actually there training them on peer support and family peer support. So it was real exciting.
That's
So that's kind of
amazing.
the biggest thing for me. And if you're talking about landmarks in our state, we're Texas, we do everything big.
Yeah. Deep
But
in the
I
heart of Texas.
exactly deep in the heart of Texas. So I would definitely say anything from our barbecue to rodeos is probably our big things. And of course, we have states and football and sports is king in
Yeah, I
our
know.
state. So yeah.
Unfortunately, your football teams are our enemies, unfortunately. I'm sorry. Yeah, but we're horrible, so it's okay. Thank you so much for the work that you do. Tracy.
Thanks, Tracy Johnson. I'm the family coordinator for the state in the state of Utah, statewide project. I am really proud. We've recently developed a relationship with the family organization. So we lost our family org. We're doing that again. That's so awesome. Really important for the peer support work, and feel like we're really making some progress. So I'm proud of that.
Excellent. Thank you so much for what you do. And what is something famous about your state? A landmark, something.
So I think we're known for especially in my area, I'm in the southern part of the state, down kind of close to Las Vegas, for our Mighty Five, our national parks. So Zion, Bryce, Grand Canyon, those Mighty Five parks in our area. So that and our big mountains.
Excellent. Thank you so much. All right. Thank you so much for introducing yourself, guys, and telling me about a little bit about your lovely state. Of course, I'm from the wonderful state of New York. And I'm going to say my favorite landmark, which is something that we really need right now, which is the Statue of Liberty. Whoop, whoop, whoop. Okay. So I'm going to move on now. Thank you so much. So I'm going to tell you about what my first experience was cross systems collaboration. So my first experience with cross systems collaboration was a partnership with ACS and the Department of Health in Brooklyn, New York. It stemmed from a challenge that they found with infants coming into care in the Bed-Stuy community in Brooklyn. And as we know, when there are infants coming into care, they're not bonding with their parents. These are the critical years, the critical times for their children. And to have infants coming in care at the rate that they were at that time was a really serious issue. And they got a SAMHSA grant, and the two agencies partnered together with other community-based organizations to really tackle this problem. DOH, Department of Health, they put their home visiting program together, and they partnered with Healthy Start Brooklyn, as well as ACS partnered with, they didn't partner, but they made more funds available, and they brought all sorts of supplies and brought in agencies that could give Pampers and strollers and all of these other things together so that they could make sure that the parents were supported in being successful in this endeavor. Suffice to say, I was blown away at how much collaboration I saw and how these agencies really wanted to make a difference together. Typically, as we know, it's hard for systems to collaborate, and a lot of them, they've been here before us, right? So they weren't necessarily um, built to successfully support the families we serve and the communities that we serve, to be quite frank. So I was really, really impressed by the collaborative effort that everybody put together. They were meeting constantly. They also had me develop a little community collaborative with a few very active community partners that we worked together, and we became involved more with ACS and the endeavors that they were doing in the community. And it really changed me. It made me who I am. And I'm a people person, as I stated, and I'm also a helper. I love to help people. I love to see my people do better. And I wanted to get involved in the process as much as I could. And I fell in love. I am so dedicated to being a peer. I have had a knock on the door from ACS, and thank God I never lost my children, but I've been impacted by that system, and I did what I had to do so that they could get the hell out of my house. I'm just being very honest. Um, but through this process, I began my advocacy work, and my first job was in foster care. And kudos to those that work in foster care, because it almost killed me. It's hard work, but I knew that I wanted to be involved in this process in some way, shape, or form, and that was my beginning. So the cross system partners. Here is a list of some of the cross system partners that we can deal with as far as helping our families, because families cross different systems at different stages in their life, right? So the Department of Education, we're going to cross that system. Some people may have children with mental health challenges. They're going to cross that system. So all of these systems here are the systems I'm talking about. But of course, there are other systems that can impact a family in their lifetime. So what is peer support? I know that a lot of you on the phone are peers or involved in this work, so you know what peers are, but I'm just going to give a little overview of that. So peer support, what do? We give emotional support. We have lived experience with navigating the systems that impact communities and families. We use our personal knowledge to help others facing the same challenges. We have been there. We have done that. And we're here to take the journey with our families, our youth, so that we can make sure that they are successful moving forward. So this is a quote that I feel is really impactful and really encompasses peer support. I've learned that people will forget what you said. They'll forget what you did, but people will never forget how you make them feel. And that is so true of peers. When you're involved in a system that is very overwhelming and scares you, you need that person that makes you feel supported, to make you feel like you're there for them. And that's what's so powerful about peer support services. I know that I worked with families that were impacted by the ACS system and foster care, and these are people in my community. These are people that I could see walking down the street. So for them to come to me and say, Miss Christina, you helped me so much. I don't know what, I did whatever you told me to do. And guess what? I got my kid back. That is so powerful and impactful. And that's what I was looking for as a peer working within the systems. So that's just my little spiel. So why is peer support so important? It improves outcomes. This is an evidence-based practice. They know that it works, right? We're not doing clinical work, and that's fine. Clinical people have their purview and their lane to be in, and they're very important. But for us, it's all about the support, that shared journey, and everything that we bring to the table, and having those real conversations with our families, that is so impactful. And it can reduce recidivism. If we're showing them or giving them the tools that they need to be more successful, then they shouldn't be coming back into this system or being negatively impacted by that system. It can lead to better engagement, right? So we have, like I said, a few, seconds ago, we have those hard conversations with families because listen, I've been here, I've done that. I am a very plain spoken person. You're not gonna get over on me. So just let me know what's going on so we could deal with this and I can partner with you and we could take this journey together so that your family can do better. We have that shared experience, and that is so important because, like I said, I've been impacted by the system. I've been through domestic violence, I've been through being homeless, I've been through a lot of different things that have negatively impacted me, but I've come out on the other side and I'm going to show you what I did, and maybe you can replicate that so that you can be more successful moving forward. There's no shaming or blaming in this because that's not where we come from. It's not about the shaming. You shouldn't be ashamed of anything you go to because, as far as I'm concerned, it makes you stronger. And I'm not going to blame you for anything that happens because life happens to people every day. It's also a network of support. The peer workforce is strong and we are powerful. And we're larger than people think. You know what I'm saying? And we're here for each other. You come for one of my peers, you're going to have a problem. I'm just telling you, because I love the peer workforce and the people that I work with. I am a very loyal person, and you're not going to, you're not going to get over on my peers. And nothing about us without us is not just a catchphrase, it's real. Don't talk about us when we're not in the room. When we're planning for our children, when it comes to their mental wellness needs, we need to be at the table having an active voice in the planning for them. You shouldn't be talking without us or talking at us or over us or talking in language that we don't understand. You should be having a real conversation with us and include us in the team process so that our families can do better. So what is cross systems collaboration? It's collaboration between different systems that have an impact on children and families, and we're all working together on a common goal. Networking and building relationships in this, in the social services, really is so important because you're going to need somebody down the line. You're going to need to link somebody to a service that can help them, and these relationships that you build, they last for a lifetime. I've known people for 20 plus years and we're still, cool with each other because we all have the same focus. We want families to do better. Like I said, these are our families. These are our communities. And, Black and brown people, we have been marginalized for a long time, and it's time for that to stop. It's time for us to work together so that we can make sure that they are successful, especially now. So I have a question for the group. Have you ever worked with a cross-system partner? And if you did, how did that look? And did it make your work easier? And was it successful? Can I have like maybe 5 people to let me know if that has happened? Anybody in my audience? Come on, y'all. This is interactive. I told you I'm a people person. Raise your hands, get on board. Let's do this. Anybody? I know somebody's worked with somebody from another system. Come on. All right,
Sure.
Carly.
Yeah, so I do a lot of cross-system collaboration work in my role. But I'll just share a little bit about what I put in for the intro in the chat. We've been working for about 3 years now with our state's Medicaid and also our Department of Child and Family Services to get family peer support in the Medicaid state plans so that it can be Medicaid billable. And I've found with all cross-system collaboration, there's a lot of things that we can't necessarily accomplish on our own. So in that sense, it does make it easier. But there are also a lot of pitfalls. You have to work on other people's timetables and their rules and regulations and policies and all of that. So it definitely allows you to do things you wouldn't be able to do without the collaboration, but it also can be difficult.
You're very right. And we'll get to that in another slide. It's definitely challenging. I totally understand. Thank you so much, Carly. Corinne Lombardo?
Hi, thank you.
Hi.
I was going to say that one of the challenges that I have seen working with one of our cross systems is in our state, we have, when a family has Medicaid, is they have to go through only one provider. And then if they are allowed to get services from another provider, then the original provider just completely drops off all services. And so with a family I was working with, our goal is always to keep the youth in the home, but this youth in particular needed a higher level of care. And so um, this specific partner that we were working with just kept denying the parent. And it wasn't until our program got involved with them. And then we helped, and I helped with the parent to advocate for a meeting with that provider. And the mom was able to get, she had, I'm not joking you, it was like this much documentation that she had color coordinated for the meeting and everything to show all interventions in every modality she had ever used. And that meeting was pivotal to get him the higher level of care that he needed. And it was a great experience for the family, even though it was like a heartbreaking experience. It was also good, but it was a good experience, I feel like, also for working with that system, for them to know that having a peer and our program did help get her, and she'll even testify to something that she had never been able to get on her very own.
Thank you so much. That's true. Um, so I mean, definitely for us as peers, I think, systems can be siloed, but we should never be siloed. We should be working together and collaboratively to help our families to do better. And like I said, families interact with different systems throughout their lives. So why aren't we working together? It just makes sense to me. Okay. So the current use of cross-system collaboration. So peer programs are used as a strategy to improve outcomes, like I stated, and also we use our lived experience in the decision-making process that can help people to do better. Right? We've walked that walk so we can talk the talks, and also the peers have insight and resources which usually goes untapped. There are places that we could probably be utilized that they're not utilizing us in right now. I have to give kudos for my state, especially when it comes to the mental health system in my state. They have plugged us into everything, everywhere. And I think that it's been so helpful for the families to have that option. You know what I'm saying? It's not all just about the clinical, it's about the supportive stance that we take for our families that can be so helpful for them. And it also can help to look at different ways to deal with our children, right? Because we may not need to always medicate a child. We may need to help them to find coping skills to utilize that can be very helpful for them as well. And also, we can help to change the social climate on things. Like I said, we are very beneficial because we work within our communities. We see these families all the time, especially in New York City. I don't know about the other states because I know that, I'm not going to speak for everybody, because I know that a lot of states, are very separated. But, and, but I feel like in some way, shape, or form, we're always going to come across some family at some point in time that needed our help. And we're responsible, really, to help them to do better and to just be stronger, you know, especially in the climate that we're in right now. People are really struggling. And for us to do better by working together, that can be so impactful and powerful. So, a reflection. So before I move forward on all the other stuff about how we, challenges with cross systems collaboration and all of that, I want you to think about a time when you got help from somebody. And I want you to tell me how you felt when somebody helped you. Anybody can answer.
Felt validated. I felt heard.
Okay. Anybody else?
I felt
seen.
I felt supported.
Relief.
Okay. Anybody else?
Respected.
Okay. Lori?
I'll add one to that. I felt heard and validated, but also it gave me confidence.
Right. Because I know for me, when I was caught in my storm and I was going through different things in my lifetime, the person that helped me was, we still talk to this day, but the things that this person did for me and the dedication that she showed to me was so powerful and so impactful. And I couldn't believe that anybody could be that giving. And that's what we are. And it gave me hope. You know what I'm saying? That's what peer support does. It gives people hope that we can get through this together, taking this journey together so that I can do better, my family can do better, and that these hard times are not going to last forever. And I feel again like this is so important right now because people are really losing faith in a lot of things, and we can understand why, but we don't want them to lose all of their hope that there will be a better day moving forward. So we're going to look at barriers for cross systems collaboration. Let me just say something. Cross systems collaboration, like the young lady stated earlier, is not easy. I understand. I started this and I really didn't know exactly what I was doing. I started a cross systems meeting, and I came up with a basic overview of what it was going to look like, but I really didn't think about all of the things that I really ran into. When you look at like things like fragmented services, our services are not all the same because we don't come from the same system. So there's a lack of shared governance. My commissioner for mental health is not the same as the commissioner for ACS, right? So we have different, our policies are misaligned and our philosophies of care are misaligned as well. I oversee family and youth peer support contracts and with my team, and my advocates can go out to court and can sit with families, but the Office of Advocacy in the Administration for Children's Services in New York City, they don't let their advocates go to court with their families, even though they're the Office of Advocacy, which is strange to me, but that's their policy. I can't knock them. That's the way they move. We have different language, varying, languages and terminology and acronyms. You know what I'm saying? I could say AWC in my system, it'll mean something, and then it'll be something else in another system. And there's also unclear roles and responsibilities. This is something that I really, it really needs to happen if you do something with cross systems advocates, because I do take on a lot when it comes to the stuff that I do. But I also could be utilizing others to do things as well, which can be very overwhelming at times. And, you know, like the young lady had stated, time constraints. I'm not out in the field. You know what I'm saying? I don't do direct service. So there are certain things I don't have to worry about when it comes to my time. I just have to know what date and time, and I'm good. I'll move things around if I can and all of that. But if you're a court advocate, you're supposed to be in court, right? If you are a foster care advocate, you're going to be in a foster care agency, or you're going to be doing home visits or whatever else that they do when it comes to that role. But I feel like it's beneficial and that it's worth it because our families are worth it. So the benefits of cross-system collaborations to enhance the peer workforce can help to break down the silos. Like I said, systems can be siloed. We can't be siloed because we use resources in the community to help families to get better. So we should be talking. There's no reason why we shouldn't. It also improves problem solving because a lot of us have different services that can be beneficial to another advocate. So why aren't we having conversations about that? Why don't we know each other? I know we can't know everybody within, our social service realm, but excuse me, it can help us to really serve our families better if we know that if I can call so-and-so from this agency and get those services that I need quicker for my families. And it also helps to break down the transition between the different systems that families are utilizing to receive those services. Because like I said, if I can call so-and-so from another system and say, listen, I have this parent and they're going through this, I'm going to transfer them to you, then she can take over, and that makes the work so much easier. And with that, it strengthens our peer roles and it expands the impact that we have on our families because we're going to get the best service that we can for our families as quickly as possible. And it allows peers to bridge gaps and provide support. So the keys to successful collaboration. It's not all negative, people. It can happen successfully, but we need to, what I'm doing right now with my cross systems meeting is I am revamping it because like I said, some of these things, when I first implemented it, I didn't think about. I just knew that it had to happen. I was impressed with how it looked when I was involved with it, but there's a lot of collaboration. Like I said, there's a lot of challenges when it comes to even scheduling a meeting. What's the best day? What's the best time? Does your boss agree with this? Your supervisor, do they agree with this? What are we going to tackle? So all of this has to be discussed prior to the formation of the meeting, because like I said, I developed the vision for the meeting, but that's not necessarily what everybody else wants to focus on. So coming together, having a shared vision and goals for the meeting or whatever you're going to do, you have to make that happen. Also, imagine if one day we could have peers from different systems in one location. I think that would be so awesome because you'll get to tackle all of these things together. You know what I'm saying? It won't be everybody doing things by themselves. And I think it would help with burnout as well. And then you're also building trust across the various systems because you're building that rapport with each other. You are seeing each other all the time and you're really building that relationship, like I said, that can last for a long time. It also leads to professional development. It can be helpful with the professional development because we don't just want lived experience. We want lived expertise, right? And by utilizing each other to figure out, okay, I'm having a training on this in mental health. Why don't you take part in that so that you can learn those skills that can help build you up as an advocate? And tell me about what's going on in your system so I can learn those skills that will help me to better serve the families that I want to serve. And also, but we also have to remember to be flexible, and it could lead also to innovative ideas. Because like I said, imagine if at some point, different advocates from different systems could all be located in one area or one location, or they have some kind of streamline of communication that they can get together and just really take advantage of each other's knowledge and power. I think that would be so beneficial and so helpful for the families that we serve. The real power behind cross systems collaboration is systems change. We got to break down these systems because they're not beneficial necessarily for not everything that's included within a system is meant for a family to go through, right? They're very disjointed. They're very large. They're very confusing to navigate. And those are the things that we're supposed to be breaking down, right? We can also have more leaders within these systems that are really helping to develop policy that's more beneficial for our families, making suggestions on how to, this is not working for our community, our families. You know, we need to look at things in a different way. These are not the decision-making people for our families. They don't come from our communities necessarily. So they don't necessarily know the best way to, first of all, deal with them, have conversations with them, and then help them to be successful. And once we get in there and we engaged our families, that can lead to sustainable change within that system because they see that the work we do is beneficial. So I'm going to ask everybody on the call. I know that we have, you know, not that much longer, but I would like one bold step call to action. This is my call to action. I would like to know what you can commit to today to start collaborating with cross systems peers in a way that's tangible and beneficial for you to do your work effectively and to help make a change within the systems that really are a challenge for our families. So I'm going to leave it there. What system do you wish you could collaborate with, and why? And what approach would you do to outreach to the system partner, and what would that look like? That's your one bold step. One thing that you can commit to today that you can do with another systems partner this is on a consistent basis though, to make a change.
So I was gonna say, I would say ACS, but I already do get a lot of referrals from mandating parents. So I would say it's the consistency of it, making sure it's back and forth. If I'm getting referrals, I'm keeping them updated, keeping that partnership. So like you said, if I ever do find myself with a barrier, I already have someone inside that I've already been communicating with, going back and forth, helping each other. So I would say just being consistent with the partnerships I'm building currently.
Excellent. Thank you so much. Anybody else?
I'll piggyback off that. I often talk about repetition, and I'm pretty new to my role. I'll be a year into my administrative role, basically as a consumer advocate, tomorrow.
Excellent.
So
Congratulations.
thank you. A lot of this last year has been about meeting people that are doing this work. I work with Division of Behavioral Health with the state, and we get to contract with family organizations who do a lot of family peer support and family navigators. And a lot of the things that I'm trying to figure out and do now, this conversation is great because a lot of people are doing the work and there's so many silos. And I work with state government, but state government is a constant barrier as well. And so I'm trying to help break down silos and to build up our Nebraska peer support workforce. We work with the certification process. We have a Nebraska certified peer support program that is not the only accepted program in the state, but it's taken a while to build traction. The people before me, I don't know. I'm not going to say words about them. I think they did their best with what they had at the time. And now, it's about like that repetition and coming back to it and building these relationships. And a lot of people are doing this work. And for me, it's about bridging those gaps and just kind of making these introductions. We're starting to have a bi-monthly. We call it the LELN. It's the Lived Experience Leadership Network. And
Nice.
I replaced something that existed before me because I was able to. And so my goal is to bring in folks from all of the 6 regions in the state and spotlight people doing the work in those communities and counties already, and just to continue to make these introductions and to kind of, be repetitive, but shine light on people already doing the work. And I'm really passionate about this, so I'll stop talking because I could keep talking.
No, I love it. I love it. That's great. I love
Yeah,
I love
you.
your passion because I'm passionate as well.
I love that.
You're in a
Keep
bad
me going,
you're in a hard spot. Thank you. You're in a hard spot because you're trying to change within government. And
Yeah.
government is not necessarily hoping to change, as we can
Yeah,
see,
it's weird.
right?
The people
It's
paying
very
your
hard.
paycheck and
It's
yeah.
easier when you work in a nonprofit, because in a nonprofit you can kind of say what you want to say. They're not going to let you say what you want to say when it comes to the government sometimes, but at least you are
No, they
trying.
won't.
Yeah, it's
I do
very hard.
anyway, though. And as I get older, I just realize my mouth gets louder.
Exactly,
Because
because you don't care.
my bullshit meter is gone down. It's not there anymore. And
Yes.
I've worked with enough quote unquote professionals to know
Yeah.
that, like,
Exactly.
I
I
don't take your
totally
title
understand.
seriously.
I
Like, who are
totally
you as a person?
understand.
Yeah, Christina, like you get me, like, yeah.
Yes. Yes,
I
you
don't care
don't
if you're an
care. You want to
attorney.
say what you want to say, you're going to say
Whatever.
it, and you're not going to be sorry about it because your passion is helping families.
Yeah,
Period.
I'm in recovery myself. I'm
Uh-huh.
8+ years sober from alcohol. Thank God.
Congratulations.
And so it is lived experience that got me through, and people in recovery that helped me find my own path. And it's real and it's free and it's there.
Yeah.
But a lot of people with clinical eyes they're doing good work. But I think
Yeah.
people with lived experience, the peers.
Mhm.
I heard someone say this in our first LELN. We've only had one. Our next one is Thursday this week, so pretty
Right.
excited. But they said that working with people with lived experience is fundamentally necessary to make these systems better.
Yes.
So peers
Yes.
can exist in any facet, in any
Yes.
realm, in any business or government or nonprofit. They make us better as humans
Yes.
because really that's what we are first. We're not data
Yes.
sets, and we're and recovery is someone said earlier, like prevention is the
Mhm.
key, because mental health and behavioral health aren't like, they're going to always be necessary, so we
Yes.
need to keep coming back to like helping the youth and their
Mhm.
families,
Mhm.
and breaking these cycles and shining light on that dark stuff. And
Absolutely. That's
someone
excellent.
said,
Thank
can
you
you
so
repeat
much.
that? I'm sorry, I don't remember
I
what I
love
said.
it.
I
Yes.
blacked out. No.
That was great. I love it. I love it. So listen to me. This is what I
Yes,
want to say.
what'd she say? It was
What I want to say, I just want to I just want to cut you off for a second because I know we don't have
yeah,
that much
please do.
longer to be together. So what I want to say is this. I would like to stay in contact with everybody if I can. Did you all put your information in the chat? Can you put your information in the chat? Because like I said, when it comes to peers, we should not be separate. I would love for one day to have like 50,000 peers in one room. That would be my ultimate, like, I would be so happy. So please put your information so we can keep in contact. And please think about, the cross systems work and how you can really make a difference. Because like I said, the people that are making decisions for our families and our communities are not necessarily the people that look like them or need to be doing it. So we need to be part of the process at all stages, and we need to be together. We are strong, we are powerful, and that is it. Nothing about us without us. Woo, 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 woo. And I thank you so much for everybody attending this session. I loved it. I like I said, I love my peer workforce, and I would love to try to, I mean, even if I can't get back to all of you, I would love to really, maybe next year we'll be together in person, which would be lovely. And I'll get to meet all you wonderful people. But I really would love to for us to do something together as peers, which I think would be awesome.
And Christina, you have about 14 minutes left if you wanted to.
Oh, I do. I
Q&A
do.
or-
Okay. I thought I was done. Okay. So anybody else want to say anything about cross systems collaboration and how we can, move mountains moving forward? What you think, guys? Angie, let me know.
So, like I said, we're kind of piloting a program here in Missouri in Franklin County. As much as a lot of people know that how important peers are, there are still those that, well, we shouldn't really have the voice that we think we should have. But I work pretty closely with Children's Division here in Franklin County, and I love that when there's a situation, especially in the beginning investigation before they actually act on it, they're like, hey, we know you work really well with kids or with the families. Can you go talk to these people before we have to make major decisions?
Right.
And I'm always, they're never scared to reach out and call me and, hey, but the hard part is when I need something from them, I need that referral form sent in. I need to know, we call TDMs, a team decision meeting. The information that I need back from them doesn't strike them as nearly as important. And we're changing our executive director and that kind of thing. So I'm looking forward to a more support in that. But it amazes me how much we can do, and yet at the same time they throw those barriers in to prevent us being able to make the changes and be the voice that these families really do need. The rules are just so, to me, so crazy, and I don't know if they're the same in every other state, but sometimes it's really, Midwest, we're kind of, they look at us as a little bit backwoods, so I don't know.
So let me ask you a question. Do you have a form that you give them to fill out and they're not doing that? Is that what the
Yes,
issue
ma'am.
is?
Yes, ma'am. Yeah, yeah. And part of that is on me because they call, and so I'm pretty active on stepping into that. But we send in a reminder, an email reminder saying, hey, we need that. I need that referral filled out, and it's just one of those things that's overlooked. We're really sorry. We just overlooked that, and it's it's kind of a challenge, but. Like I said, it's a pilot program, so
Right.
there are a lot
That's
of
the kink
barriers.
that has to be worked out.
Yes, ma'am. Absolutely.
Yeah.
But I love being able to make that difference because, like you said, we've been there. So being able to, these are the things that work really well, and these are the things that do not work so well.
Yeah.
I love it.
Yeah. Totally.
Thank
It's totally worth it. Thank you
you.
so much, Auntie. Anybody else have any questions, cares, concerns? Anything they want to mention? Anything fabulous that they're doing right now? Because I know you're all doing wonderful stuff.
Well, I have a question. I work for a government county agency as a family support partner. Do you or anyone else have any advice on inside making change in this within the system?
So let me ask you a question. Do you see anybody there that's interested in this besides yourself? Like, what is your supervisor say? What is your director like? What is their stance when it comes to family peer support and helping families?
Well, out of 90 peers in the whole entire agency, I'm the only family support partner. So I'm actually advocating for a portion of the workforce to be trained in family support partner, maybe, or I mean, I hate to say it, but maybe change those jobs because there's so many peer direct
That's a lot of
peer.
peers.
That's a lot of peers, and there's a
Yeah.
lot of families. We have youth and there's a lot of families that actually need support, wraparound.
So they don't
So
have a job title? What is their job title?
peer support, peer
So they're
support
supposed to be
person.
providing peer support for people that come in for families that come in contact with.
Yes. So they're also doing family support, but they're not trained in it, or maybe they don't have, or maybe they do have experience. But
Is
I
there a
feel
credential in your state?
state of Virginia is yes, it's by FREDLA,
Oh, okay.
Parent Peer Support Partner,
Yeah.
PPSP. Yeah.
Okay. All right. So at least that's a good start. They're taking that.
Yeah.
And then I know there's a lot of need in Virginia.
There's a lot of need, yeah.
What part of Virginia are you in?
Well, I'm in Northern Virginia. So I'm not in the desert wasteland of, I think there's,
No. Name an area, because I'm familiar with Virginia, like Richmond and Chesterfield and all of those areas.
like Fairfax, Virginia.
Oh, I love Fairfax. It's beautiful. I used to go to a lot of national trainings there. I love Fairfax. Okay. All right. So they brought all these peers in and they want them to do family peer support, but
well, I guess like the peer workforce, even though it's large, is not integrated fully, or at least I haven't like seen it them integrated fully. And we're all in silos. We don't have like group supervision. We don't know each other outside of, I know one other peer in the whole 90 that I work with.
And when you say the state of Virginia, what exactly, like what system is that?
It's the Community Services Board.
Oh, okay. All right. So
it's community-based support.
Right. So are they actually speaking with the community?
Yes. Well, I think so. We're all siloed. I actually don't even know what my question is anymore. Maybe I'll give someone else a chance to.
No, but this is interesting to me because you have all of these peers embedded in this community support division, and everybody you said is siloed. So what are they doing? They're supposed to be doing peer support, but it seems like there's no clear role, like there's no clear
There's no
collaboration.
There's no connection between the peers, the peer cohort within the agency.
Okay.
And I don't know why that is. So I guess it's above my pay grade. I'm a family support partner. I do direct service.
Right.
So I don't know if anyone has any advice for
Well,
someone at
first of
my
all, you would need to
level.
know what they do.
I guess so. Yeah.
Yeah, and where they
That would
are,
be
because
nice.
yeah, because you have this whole community group of a lot of peers that are all over the place and you don't know what they're doing. So that would be a good place to start. What are you doing? How are you doing it? Where are you doing it? You know what I'm saying? All of those things need to be answered so that you can work more collaboratively. And Fairfax, that's a nice area.
It is. We have a lot of need.
Yeah, it's a nice area. So what are they supposed to be doing there? That's what I'm not understanding. If you would have said Richmond, I would have been like, yeah, you need to be doing this, and this, because I'm very familiar with, a lot of I spent a lot of time in the South, especially in
we have a lot of people who are like have housing insecurity, food insecurity. It's just like everywhere else in America. I mean, we have a lot of people with we serve the most vulnerable in our community. So yeah, we're just like everywhere else, even
Right.
though there's a
But
lot of
you
people with a
guys are
lot of
working
money
so
that,
separately and you don't know what each other's doing.
yeah,
So that would be a
yeah,
good place to start.
yeah, to
Like, what
kind
are
of,
all of these people doing and with who and where?
well, I have a question. Does anyone know of like a peer? I know like clinicians and therapists and have, oh, okay, yeah, I was gonna ask, like, is there like a, not like an organization, not a, what am I talking about? A union for peers.
There's no union for peers. It's funny because I wanted to start a membership thing for peers. I didn't want to start a union, but like a membership thing for um peers, but we don't have a union. Now, if you're in an agency, now there are some, okay, I know in New York, I'm just going to speak for New York, there are advocates that work in hospitals that have unions. There are certain agencies that have unions, so those peers have unions. But there is no one like Family Support Union of America. You know, this oh, maybe I should start that. I don't know. I'm just
I really think maybe this is the conversation to start something like that, though.
yeah.
And I
That's
can't
so
see the
good.
name of the person talking, but it sounds like you'd be a great person to like just start asking questions.
Yeah.
Just I'd go to my supervisor, my direct leader, and start asking questions and then start getting permission to ask other people questions because sometimes it just takes one person to like really start asking the right questions to make all that change, you know.
Yeah, definitely. Because
I
I
watched
feel
the
like we
newsies last
need to
night. I'm
have
really
something like
inspired.
that because they
So
can treat us however they want. They have different things for different, you know what I'm saying? There's no streamline, you know what I'm saying? And even though we're not streamlined because we do things in different ways and different, you know, systems and stuff like that, but there should be one place for us to have like a peer. I don't necessarily want to call it a union, but something peer that joins us or that unites us, right? And fights for us.
Yeah,
Because
like
there's a lot of peers that need fighting for.
in the one year that I've been working for this community-based or government
Uh-huh.
agency, there was one peer meeting and there was about 30 peers together. And one woman said that her whole team got raises after COVID, um, all the first responders, but during COVID, she was like one of the few people that was in the office seeing clients and families in person, and she didn't get a raise. And that still like burns me. And the director of peer services for the agency heard this, and I mean, I don't know if anything was ever done, but like that whole like pay disparity,
Yeah, yeah.
and we're doing the work of first responders, but not treated as such. Like it just, I don't know. Yeah. Okay.
That's a bigger question than Christina. Unfortunately. But like I said, I have thought about that. I have definitely thought about that. And we definitely do need some protections. And I feel like, especially when it comes to how we're treated, like you said, the pay, all of that stuff, that's something that we need to, but that's something that we would have to talk to together as a body. You know what I'm saying? That's a big undertaking, bigger than me, bigger than you, bigger than a lot, you know, people on this call. We would that's a lot, you know, but it's definitely needed. And I thank you so much for bringing that up because it's definitely a challenge, you know. Different peers deal with different things and they're asked to do a lot. And some are, you know, we do so much, you know, so many things different, you know what I'm saying? But it's definitely worth a conversation. That's what I'm saying. So thank you so much for that.